give yourself the time and the space and all the support you need and really lean into it. Because I think what happens in the NICU is you have to kind of keep it together really quickly because you want to be there for your baby and you're trying to figure out what they need and how you can support them, or your baby's starting to pump and it's a busy time.
Hi guys, thanks for joining me today. My name is Krista. I'm from Mom Talks with Krista, and today I'm so excited about our guest because this has been a long-awaited topic. We are talking about high-risk pregnancy and preemie care. This is something that we hear in our group all the time. We want people to talk about. So I'm so excited to welcome Parijat to the show and to answer all of our questions. So welcome.
Thanks so much.
I'm so excited to have you here. So just to get started, can you just tell us a little bit about you and what you do, and then we'll kind of go from there?
Yeah, absolutely. So I am a health strategist, an integrative health strategist for women going through a high-risk pregnancy, specifically a high-risk pregnancy after second or third trimester loss or preterm delivery. And I got into this work because of my own personal experience of having gone through a very high risk pregnancy and an extremely preterm delivery and a lengthy NICU stay. And it was my personal experience that really opened my eyes to where the gaps are in our current system in terms of supporting women. And specifically, what I found is that there's no conversation about how to support the neurobiology of pregnancy in order to actually reduce the risk of pregnancy complications and help you stay pregnant. And so when I kind of dove into the research after my son came home and I was ready to kind of start working on this, I found there's 70 years of research showing the impact of supporting neurobiology on actually extending pregnancy and reducing the risk of complications. And I thought, how come nobody's talking about this? And so I made it my mission because I know what it's like to have gone through this personally. And
Mhm.
even with the most incredible medical team, there are still gaps in that care. And I really thought it was so important to bring this message into the world and to teach women exactly how they can support their bodies to
Mhm.
improve pregnancy outcomes, improve maternal outcomes, fetal outcomes. I mean, there's so much that we can still do, even in a situation like that, where it feels like everything's falling apart. And I know that personally what that feels
Mhm.
like. And also, there's so much we can do. And I find there's a lot of hope in that. So that's what kind of brought me to this work today.
Yeah, that's awesome. Yeah, I think what you said about kind of losing hope and thinking kind of it's out of your control at a time. So it's awesome having you here and share your knowledge and experience. So you kind of have the two sides of it because you can
Yeah.
bring a lot of experience into this whole conversation. So kind of starting with premature babies. So for those listening that aren't too familiar, what's considered a premature baby and what are some of the reasons babies are born prematurely?
Technically, a preterm baby or a premature baby is a baby born before 37 weeks. And even though, so due dates are calculated around 40 weeks. And so there is kind of a 3 week buffer that baby might be born before a due date, but is not technically considered preterm. What they're doing now in the last several years is we're considering a full term baby after 39 weeks. And then there's early term, which is kind of 37, 38 weeks or so around that time. And the reason for that distinction is technically you're delivering at term after 37 weeks, but we're finding that there are some additional developmental benefits of delivering after 38 weeks, ideally around the 39, 40 week mark, regarding neurological development, lung development for baby. But it's not so early where you start to see kind of longer term complications between the 37, 38 week mark, as opposed to a baby born before 37 weeks. So long
Mhm.
story short, preterm baby is born before 37 weeks. And there's a number of reasons why a baby can be born preterm. And they're kind of split by complications that impact mom versus impacting baby. So maternal complications can be any number of pregnancy complications that either impact the pregnancy, impact the woman's health or the birthing person's health, and require that the baby be born early to save or support mom's health.
Mhm.
Or there can be fetal complications, for example, fetal growth restriction, intrauterine growth restriction, issues with blood flow to baby, issues with baby's heart rate, for example, certain complications regarding any number of body systems during the pregnancy for baby that you sometimes can find in more detailed testing, more detailed ultrasounds or more invasive testing, that the providers at that point decide it's actually more beneficial for baby to be born, so we can intervene in a way that we can't help the baby in utero, for example. And then there's also reasons such as drug abuse, sometimes alcohol use, recreational drug use, things like that. Sometimes it has to do with some blunt force trauma, for example, if mom falls down the stairs and, falls in a certain way or gets into a car accident. So sometimes it has nothing to do with the health of either one, but for some reason, it's just the solution is to deliver, whether that decision is made by the medical team or made by the body. For any number of reasons, there could be the reason to deliver preterm.
And is there ever a reason like that a doctor would know like early on in the pregnancy, like, oh, this is going to be a premature birth? Or is that something that doesn't always have plan, like can kind of just happen? Or is there times, where a doctor might know early on?
Yeah. It could go either way, which is very frustrating because you kind of, at least if I'm going to have a preemie, just tell me and I can prepare, is kind of the thought process. At least certainly that's what I thought of as well. For example, in my case or cases like mine, there are multiple complications that are adding up over time. And so by that point, you're kind of thinking, I remember when I was in the hospital around 23 weeks, we had kind of changed the target date from my due date to 28 weeks. We're like, let's just make it to 28. So, it does adjust based on what's going on in the pregnancy for sure. Oftentimes, like the women that I work with privately, they already experienced a second or third trimester loss or preterm delivery, which automatically makes the next pregnancy high risk for preterm delivery. And sometimes there is spontaneous preterm labor and spontaneous preterm delivery where there's very little notice and something just happens without a lot of lead time, and before you know it, baby is born early, and that can happen. When we take a neurobiological approach to trying to understand spontaneous preterm delivery and preterm birth, there is a little bit more answers than we often get from our medical providers in terms of how the nervous system, the endocrine system, which is tied to hormones, and the immune system, which is often tied to inflammation, how they kind of work together, that are sometimes giving us clues ahead of time that usually the medical system can't find. That's kind of going, orange flag, this might happen. But things like if you have a complication called an incompetent cervix or cervical insufficiency, meaning your cervix is shortening, there is data that shows if it shortens by a certain amount by a certain point in the pregnancy, your risk of delivering preterm does increase. So there are some complications where you kind of have an idea, and there are others where you maybe don't even have a complication, and all of a sudden, before you know it, baby's born early.
Oh, wow. And so I know with premature babies, there can be a lot of different health risks. So what are some of the short-term versus long-term health risks that can occur?
A baby born before 37 weeks, it really varies depending on how early they are. So, for example, my son was born at 24 weeks and 5 days. So what he faced in the NICU at that point is very different than usually what the 35-weeker will face, and everything in between. So it really depends on how early the baby is. But typically, what the short-term concerns are, can they breathe on their own? Can they regulate their temperature? Can they regulate their blood glucose levels? And can they stay warm? It's essentially, can they regulate and can they actually be without intervention? Now, again, you can imagine the earlier the babies are, the more interventions are required and the longer it takes to get there. But that's essentially what you're looking at kind of short term. And again, the earlier they are, also there are various other factors that could be complicating their development and their health, including complications to any number of body systems. So you might notice in the NICU they do an ultrasound of the brain. They do echocardiograms for the heart frequently. They're checking their lungs frequently, kidneys, livers. I mean, everything they are looking at to see if everything's okay. Another complication that could happen for preterm babies, and again, this is more often for the earlier babies, a problem with the gut and the intestines. And so any number of systems can be affected at the time of birth. The closer you are to 37 weeks, the less likely that is. That's not to say that it doesn't happen, but it's just far less likely. As we kind of come out of the NICU and going forward, the longer term complications can be really varied depending on what kind of the health of the baby was before, genetic factors, lifestyle factors at home, and just so many different factors. But there's a higher risk for preemies to have developmental delays, gross motor, fine motor delays, speech delays, or some kind of issues with speech, feeding, sensory issues, learning disabilities, things like that. Not to say that it happens to everybody, but there is an increased risk.
When it comes to evaluating or checking your baby for different risks, do you recommend parents like take them to specialists right away, or kind of as they get older and grow to kind of have their doctor check different milestones and that kind of thing?
I definitely recommend finding a pediatrician who is familiar with working with babies born at the gestational age where your baby was born. So I remember when I was getting ready, my son was getting ready to be discharged, and we were starting to do research on pediatricians ourselves. There were a lot of pediatricians who were like, yeah, we work with preemies all the time. But when I asked how early were they born, oh, 33, 34, 35 weeks, usually something like that. A baby born, like we just talked about, the baby born that late in the pregnancy has very different concerns and has had a very different path up until now than a baby born as early as my son was. And so that was a question that I thought was really important to really clarify. Who has had experience with what are called micro preemies, for example, the super, super tiny, really, really, really early ones, because it's a very different path. And with that, then we were able to have a lot of reassurance that our pediatrician was watching out. And at the time of discharge, we were certainly already seeing specialists. Some of them were from the hospital that we just saw outside of the hospital. Some of them we had to find new because they didn't transfer. They didn't provide care outside of the hospital. And so at the time of discharge, often you'll know which specialists you need to follow up with. And for the babies that are born closer to that 37-week mark, there may not be anybody. And so if you have a pediatrician that is really good at being proactive and looking for those, orange or yellow flags before they even become red flags, that's often a really good sign that you might be able to catch something sooner before it becomes a huge issue. And then if your state allows it and you're able to, I think it's always a great idea to enroll in early intervention and just have some of those specialists checking, just keeping an eye out. Best case, everybody keeps telling you everything's great, no issues. And you can rest assured that you have enough eyes looking at the health and development of your baby. And worst case, somebody catches something with enough time and notice for you to actually intervene and do what's necessary to support your child's development.
I know you've already shared so many amazing tips for moms that have premature babies. So, but what would you say is one of the most important things for moms to know that because we get questions all the time, moms with premature babies in the group, and wanting to know about health and how to take care of them. And so, what would you say is a really important tip for them to know?
Oh gosh, can I say two?
Yes, absolutely.
Okay. So the first I would say is how do I say this? Remember that when your baby is born, their whole life and their whole journey is not mapped out for them. We still have a lot to learn about who they are and how prematurity is going to affect them. One of the best pieces of advice I received from a NICU nurse I had was two babies can be born at the exact same gestational age and have completely different outcomes. And I actually have a friend who has a son born at the exact same gestational age as my son. They could not be more different. What my son struggles with, he doesn't, and what he struggles with, my son doesn't. It's so varying. And so because of that, I realize that it can bring up a lot of overwhelm because that means you don't know. And sometimes we just want to know. And I encourage you to think about your child's development really on a micro level. How are they doing? Especially when they're infants in the first year or two, you're looking at kind of week by week oftentimes. And then you can extend to, like quarter by quarter, or half year by half year, and then by year. How are they doing? And trust that they're going to show you when they need support and where they need it. And our job is to just notice those flags. And then we find the people who can help us, right? And I think that that's really important because we do try to, and I did this, absolutely did this myself, but just tell me what's going to happen. And then I'll do all the things to prepare myself for it now. And there's a lot of anxiety about, is this the appointment where we find out there's a delay? Is this the appointment where we find out there's something wrong with his heart or his kidneys or something? And we don't know is truly the answer. And if you can take your attention from what everybody's telling you and focus entirely on your child, they will tell you what they need and where they need that support. So trust that it's going to unveil itself in the time that it unveils itself. And again, I fully recognize that it's much easier said than done. And also I find that it takes a lot of the overwhelm out, because now we're not trying to predict 3 years in the future, because that's this child who you have now is going to be a very different person 3 years from now, for example. And then I think the second thing is, which is I think is tied to this, is you are on a marathon. You are on a marathon. You're running a marathon. Don't try to sprint it. So in taking such good care of your child, please don't forget about yourself. Do what you need to do. And I'm not talking necessarily about bubble baths and, rose scented, whatever. Do that if you love that, totally. But I'm really talking about, don't neglect your basics, your day to day, take your showers, make sure that you're meeting with friends, at least on Zoom, until we can meet again in person. Exercise. Don't feel guilty about going to work. Like you have to fulfill yourself, because this is a long road. And especially for those of parents who have children, no matter how preterm they are, who they know have long-term complications or health issues that they're going to be dealing with, please remember not to sprint this marathon, because it will catch up with you. And I know that we don't want that for ourselves or our children. So just a little gentle reminder there, which I also wished I'd had earlier as well.
Yeah, no, I think that's amazing advice. I think so quickly we want to figure everything out, and it's so easy to neglect ourselves. One of the things I keep hearing from moms too, in similar situations, is one of the hardest parts is leaving the hospital without your baby if they're staying in the NICU. So what tips, advice, anything do you have to share with those moms, kind of going through that rough period of, okay, I'm going home. I'm kind of feeling like I'm missing something and I'm not where I should be. So yeah, what would you say to them?
I would say grieve that loss. Give yourself the time and the space and all the support you need, and really lean into it. Because I think what happens in the NICU is you have to kind of keep it together really quickly, because you want to be there for your baby and you're trying to figure out what they need and how you can support them, or your baby's starting to pump, and it's a busy time. And I find that there's often not a lot of space to acknowledge all the losses and all the things that are just really hard, and to really sit with them and acknowledge them, because it is in sitting with them and acknowledging them that they don't actually bury into the body and encode as trauma. So I think the best thing I can say is, yes, that day is awful. And every night that you leave that NICU and you go home without your baby is awful. Give yourself the time and space to grieve that.
It's definitely important. Kind of in general, I know there's so many different, you were saying every baby is different, and that goes for babies in general, people in general. But what are some general kind of items that, moms of preemies have to do a little bit differently versus a full-term baby, and overall health or breastfeeding, those kind of things that they should kind of look for?
I think it depends, like we've talked about, it depends on what's going on for the preemie. So if let's say I've worked with women who've delivered at, 35 weeks before, and baby didn't need any NICU time, and they went home just like every other family, maybe with a slightly tinier baby than otherwise, but from the outside, you couldn't tell. Right. And so it's possible that at the time of birth and soon after birth, things may not be very different. And you might be able to breastfeed. You might be able to do everything you thought that you wanted to do. And the only difference is you delivered several weeks before your due date. There could be other times when you're in the NICU for a couple of weeks or a month. And in those situations, you're certainly looking at probably pumping for some amount of time until baby is strong enough and ready to try breastfeeding, if that's what you want. You might have to make some decisions, for example, around donor milk if you're not able to produce milk quickly enough or enough for baby, or you choose not to lactate, which is entirely your decision and totally okay if you decide that. Sometimes, depending on what's going on with the baby's growth, you might have to fortify. So even if you are producing or you really wanted to breastfeed for the health of the baby, you might have to make decisions about fortifying their feeds, for example. And then again, it depends on what's going on with the baby's health. But after discharge, you may have specialists, pediatric specialists, who you need to follow up with at any kind of intervals. You might have OT, PT, SLPs, you might have cardiologists, nephrologists, neurologists, I mean, any number of things. Some preemies go home on monitors. So you might be taking your baby home on oxygen, or they might need you to monitor heart rate at home, or you might be going home on a ventilator, something like that. There's a wide range of things. I think what I would say is, as much as possible, don't assume what your baby is going to need at discharge. Because even if you're in the NICU for a couple of weeks, that baby is changing every single day. It's a brand new baby every day. And sometimes they just need time. And at some point in their development, things start clicking and they suddenly come off of oxygen, or they're suddenly able to breastfeed when they were taking everything through the NG tube, but up until that point. So take it really slow. And as things are presented to you and maybe your medical team's going, yeah, no, I think we're going to need to follow up with cardiology after discharge. Okay, now we can add it to our plates. And now let's open that door and investigate, what does that mean? And what questions do I ask and how often and things like that. So I would suggest, because it is so unknown and so varied, take it really, really slow and address what's presented to you right in front of you. As much as possible, stay focused there instead of thinking about all the other things that could happen, which again, from a personal level, I totally get how hard that is. And also, if you can do that, it will just save you so much energy as you are, like I said, on this marathon.
Yeah, awesome. I love that analogy about being on a marathon. I think that's perfect. So I know we obviously also want to talk about high-risk pregnancies. A lot of times premature births, are they tied into high-risk pregnancy, or is that labeled completely separate?
Yeah, it is possible to deliver preterm with a low risk pregnancy. And oftentimes when that happens there is spontaneous preterm delivery. So nobody saw it coming and everything was totally fine. And there were no other issues that were known at the time that would even indicate that you would deliver preterm. That doesn't happen very often. So anyone who's listening going, oh my gosh, is this going to happen to me? It probably won't. But I think that's usually the case when there's when it's not tied to a high risk pregnancy. Otherwise, there's often some kind of a sign, some kind of a signal. So for example, you're carrying multiples, twins or higher order multiples are going to likely be delivered preterm. Not always. There are moms who are able to carry twins to term, absolutely, but the risk is higher. So for example, in those situations, or you might have a very low risk pregnancy, everything's going wonderfully, and then you go to your appointment and you find out your cervix is shortening all of a sudden. So suddenly that makes you high risk, or everything's going perfectly, beautifully, wonderfully, super low risk, and then you go in for your appointment and they find protein in your urine and your blood pressure is a little bit higher, or you're swelling a little bit. So no signs up until then. At that point, you become high risk. So I find the label to be less important than what's actually happening in your body and how much is that influencing what could happen for delivery and the timing of the delivery.
Okay. So at what point, and again, I'm sure this differs between each pregnancy, but at what point are moms told that their pregnancy is high risk? I know you did mention previously, if their first pregnancy was high risk, typically their second will be. But for someone, if it's their first birth, how early could they be told it's high risk?
I feel like I'm just like, it depends all the time.
I know.
So there are some factors that we know. So in the United States, if you're over the age of 35, you're automatically categorized as high risk, which is why I don't love this title or the label so much, because it doesn't actually mean anything other than you're going to have some extra eyes on you, and there are slightly more risks for complications for you or baby during pregnancy, during labor or delivery. But it doesn't mean that it's for sure going to happen or that it's even likely to happen. You could just be, 36 and pregnant, because that's when you got pregnant, and that could be it. And you could have a very uncomplicated, simple pregnancy and smooth, easy labor and delivery. So things like that. So age, whether you're carrying multiples, will put you in the high risk category. If you have a history of preterm delivery, second or third trimester loss, some perinatologists will calculate a high-risk pregnancy based on even recurrent pregnancy loss in the first trimester. Not all of them will do that, but some of them will. So some of those factors, if you have a history of any health complications like cancer, oftentimes autoimmune diseases, asthma. I'm starting to see more perinatologists qualify depression, anxiety, and maternal psychiatric illness as risk factors. So they consider those pregnancies high risk. If you have, kidney disease, heart disease, diabetes, things like that will put you in the high risk category. And so you'll know that before you're even pregnant, all those kinds of things. After that, let's say none of that applies to you, and then you get pregnant. The complications can begin at any point in the pregnancy, which again, I realize can sound really scary. So I don't mean to say it's definitely going to happen to anybody that's listening, but that is actually also the reality, is that you can make it through the first trimester, which is often the trimester that women are like, okay, if I get past this, that's the scary time, which it can be for many, certainly. And also there are complications that can pick up in the early to mid second trimester, end of the second trimester, or even the third trimester. And so it really depends, which is why really good quality prenatal care is so important. And that you are monitoring yourself really well, that you have a really healthy lifestyle, and you are taking good care of yourself beyond just diet and prenatals and exercise. Like just whole health support can really help reduce those risks, as can neurobiological support, to really help keep your body kind of in as optimal of a place as possible to reduce your risk of complications.
Awesome. And I mean, I love the balance too. I mean, I think like it's good that this doesn't happen to everyone, but it is good to be realistic too, that, this can happen at different times in your pregnancy, because, we want to share as much knowledge as we can here. So with high risk pregnancy, you're saying it's kind of like this label that, oh my gosh, it's high risk. But yeah, if you're 36 years old, it's automatically a high risk pregnancy. So in what ways are you monitored differently in a high risk pregnancy? And is it different based on the reason why you're high risk?
Yeah, it does depend on the reason why you're high risk. So if you're high risk just because, say, age, or because you're carrying twins or triplets or something like that, typically most women who have high risk pregnancies will have at least one check-in with a perinatologist. There are some cases, for example, if you're like the example we're using, you're 36, you're carrying one baby, there's no other health complications, it's very likely your OB is just going to continue working with you. You may not even see a perinatologist, and your OB is going to keep eyes on things. And if anything starts to look even orange flags, like, they will send you over. So you may not actually even see a perinatologist. Most of the time, many OBs will give at least one check-in and say, just go check in with them, do an assessment, or do, a consultation. They'll probably tell you everything's fine and you won't see them ever again. So that's kind of on that side of the spectrum. And then depending on what's going on in the pregnancy, if there are multiple complications, like in my case, for example, or a lot of my clients, there are multiple either maternal or fetal or both complications happening. And so you could be seeing your maternal fetal medicine specialist weekly for ultrasounds, for testing, for blood work, for any number of things. And you may also have, which happens to my clients as well, sometimes we need to add other perinatal specialists, perinatal cardiologists or nephrologists or pulmonologists, because you do need even that additional specialized care. So it really, again, it depends on what's going on in the pregnancy, but it can be really vary at any point in that spectrum.
Kind of like amazing advice you offered for moms of preemies, or I kind of want to hear your advice for moms that are currently in high risk pregnancy, because I'm sure, depending on each situation, it's different, but it can be extremely stressful and, like to just focus on, everything going on. So what advice or tips would you have for those moms?
It would be similar to the Premie tip of take it day by day. So I get it. I say this and my head's also going, but you did this too. So I get it. I understand our need to plan and prepare and really want to know kind of what the future holds. And also the best thing that we can do for ourselves and our body is to be focused on what our body needs right now, because that's the thing we can control. I think you started this whole conversation about this idea of high risk pregnancy can feel like we're out of control. And I find that finding those points of control is so important. So you can control, for example, what you put in your body when you're eating, when you're drinking. You can control how you're able to move, even if you're told to be on bed rest or have modified activity restrictions. You do have choices still within that. Very, very rarely will a woman be asked to like not move at all. It's like a teeny tiny percentage of people. So where can I find opportunities to make choices? Where can I find opportunities to impact my body and my pregnancy within the parameters that I've been given? Like find those opportunities to make those choices and take back some of that control. You can't control the outcome. Nobody can. Your medical team can't even. But you can influence the journey to get there. And I think that's really powerful and kind of taking back some of that power that feels like it's often taken from you when you've developed complications or are faced with some really scary situations.
Yeah, definitely. And so I know you post like a ton of helpful information for healthy high risk pregnancy on your socials. So I just for everyone listening, what other kind of courses or advice do you offer on your pages for all the moms listening?
So the best place to start is, well, first come to Instagram and say hi, because I'd love to meet you. Let me know we met through this podcast. I think the best place to start is my book, Pregnancy Brain, which describes kind of the neurobiological approach that I keep referring to. How do we support our bodies in a way that we're not being told through our medical care in order to reduce the risk of complications in preterm delivery. So that's called Pregnancy Brain, which you can grab on Amazon and Barnes and Noble, or you can request it from your local bookstore or library. And then I specifically work with a very small number of people one-on-one through their pregnancy after second or third trimester loss or preterm delivery to actually support them to optimize their health and healthcare in their next pregnancy, to improve their outcomes in their next pregnancy. That's a very, very tiny group of women that I work with every year. But if that sounds like something you'd love, I would be honored to work with you through that.
That's great. And any of the links you have that you want to share, I can put below too, so people can easily find them as well. And so I always like to end our podcast with a couple of fun thinking questions, I call them. So if you could have a billboard made today where you could share one tip with moms everywhere, what would you have it say?
You are so much stronger than you feel right now.
Love it. I think it's perfect. That's great. And what is a quote or a phrase you think of often when it comes to parenting or just life in general?
I think lately, actually, especially in the last year or so, what's been coming up a lot and just kind of tumbling out of my mouth is everything's going to be okay. We're going to be okay. It just kind of, without even thinking, I realize I'm saying it. And my little one just said it to me the other day. And I was like, where'd you hear that?
Oh, that's awesome. And it's sometimes like the simplest phrase can make all the difference. And just like a reminder of like, you know what, this too shall pass, if it's, if you're going through a rough time or, what have you. So
Yeah.
that's awesome. And one more time again, where can everyone follow you, your Instagram and all that?
Yes. So I typically hang out on Instagram. You can find me on healthy.highriskpregnancy on Instagram. We'd love for you to come by and say hi, or if you want to take a screenshot of this episode and tag both of us and let us know what your biggest takeaway was. I love hearing that from listeners too.
Yay. Awesome. Well, thank you so much for coming on, Parijat. It's been awesome talking to you and great getting to know you and what you do.
Thank you. Thanks so much for having me. This was awesome.
Hey guys, if you found this or any episode of Mom Talks with Krista helpful, please like, comment, subscribe, and of course, share it with your friends. We release new videos every single Wednesday, and our new podcast is out every single Thursday. So lots of different ways you can catch us. And of course, if you're not following us on our socials, go ahead and follow us there. We've got tons of new content for you every single day. And finally, if you're watching this and doubting yourself, you're doing a great job. So thanks so much for watching, and I'll see you next week.